Namaste and welcome to Sundays with Kaivalaydhama. I am Prameet Kotak and today we have with us Dr. Praseeda Menon.
Namaste.
Doctor is a research officer in the Scientific Research Department as well as an assistant professor at the GS College of Yoga and Cultural Synthesis. She teaches yoga and mental health and research methodology. As a research officer, she conducts collaborative scientific research on the efficacy of yoga in holistic health, healing, and well-being. Doctor has played a key role in bringing Kaivalaydhama's 96-year-old research journal Yoga Mimamsa online, and she also handled its editorial responsibilities from 2014 to 2015. Apart from being an integral member of the Kaivalaydhama ashram, she is very passionate about unearthing the scientific treasure in Indian traditional knowledge and its systems through collaborative research and education, and unraveling this timeless knowledge to the world. Dr. Praseeda, welcome once again.
Thank you so much.
Namaste, and thank you so much for your time and your knowledge.
Thank you, sure.
The common denominator, a disease we encounter on a daily basis, is stress. The number one silent killer. But fear not, because we have the number one silent remedy. So let's look at the role of yoga in stress and related chronic diseases. Doctor, is stress too broad a term to be described in one syllable? If so, can we elaborate on how stress is defined in today's day and age?
Sure. So, we hear this term stress so often in our life, and yes, it is too broad a term for anything and everything that affects us and troubles us. So, today we will try to gain some sort of understanding of stress, which will help us practically, but which also has a scientific basis. So, what is stress? So, we will have a slide coming up there just so that you have better understanding of what I am saying. So, if we look at stress, it is basically a response of the body, a response of the mind. So, why do I say that? So, when I mean response of the body, it means that your body is responding in a certain way to a stressor, and that stressor can be anything. It can be somebody falling ill in your house and you having to take care of that person. It can be an upcoming deadline that you have to meet. It can be anything. In fact, this situation may also put a little bit of stress on us, so that we try to deliver the best we can to you. So, our body is secreting certain hormones to this situation that we encounter in our day-to-day lives. So, certain hormones like cortisol, adrenaline are released. Now, this is at the bodily level. It's a bodily response. What about the mind? The mind, when you are stressed, is also responding. And how? Because there is emotional disturbance. You're not really your usual easy-go-lucky, happy-go-lucky self. You are a little bothered, you are a little disturbed. In your mind, you're a little irritable, nervous, anxious, however you call it. So, the mind is also responding. So, that is why we call it as a psychophysiological response of the entire system that we have, the body-mind system. Now, we may think that everybody responds to stress in the same way, but no, that is not the case, because stress is a very subjective response. It is very personal. And why do I say that? Because how do we perceive the situation? That matters a lot. Sometimes a particular situation may be very stressful for some person, and the same situation may be thrilling for the other person. That can happen. For example, people who are very good public speakers, they may derive a thrill out of the audience that they see in front of them. But for a person who is very shy, the same situation of public speaking may create a lot of stress. So I always give this example of a giant wheel. For some people, the giant wheel is a thrill. For some people, it is a very scary situation. They don't want to sit inside the giant wheel. So what we understand is that stress is a body-mind response, but it is also a subjective response, which is so because the individual perception in stress matters a lot. So with this background of stress and the nature of stress, let's try to have a very simple definition in terms of an equation so that we can remember it and use it in our day-to-day life. So we'll have the point there which says stress is equal to what? Perceived demand being greater than perceived coping capacity. Now, if you don't understand this equation very well, let me try and explain it. Now, imagine there is a demand created by a situation, say an upcoming deadline, and that deadline is very important for you and for your team, and that is why you are all geared up to meet it. So that demand is there, which you perceive as an important demand, you want to meet it. Now, in terms of your coping capacity, you feel that you can meet that demand very well. Or even if you feel that in terms of abilities, you are okay, but you have a team which has those other abilities which can cover up for you, and so you have solid resources in terms of your team, in terms of your abilities, in terms of how you are going to meet the demand, which means that the perceived demand of the situation, which is slightly stressful for you and stressful in terms of the deadline that is coming up, and the perceived coping capacity, you feel that okay, this demand I can very well meet. So perceived demand is equal to perceived coping capacity, and sometimes you may feel that your perceived coping capacity is higher than the demand. Then what will happen? Then there is no stress. Why? Because it's equal, or this is higher. Perceived coping capacity is higher. But you reverse that situation. You take the demand to be higher than your coping capacity. Then what will happen? Then you feel tensed. You will not know how to do, you will lose control, you'll be so, in fact, you can even enter into a panic situation if the perceived demand is so important and you know that if you don't meet it, something very bad will happen in your life. Then this gap of the perceived demand being higher than the perceived coping capacity is creating the stress. So, in our day-to-day lives, if we can remember this equation of how stress is created and what we can do to remove that factor and sort of equalize our demand and coping capacity, and this is again all perceived, how we perceive it. So, if we try and become aware of where the imbalance is and try to correct it, probably to some extent we are able to at least be aware of the steps that we can take to counter that stress that we have. So, I think that is like a practical as well as blended with science sort of a definition of stress, and I hope the viewers have understood this.
No, thank you for that. That was some fantastic information on stress. It now makes sense on how I used to wonder why some people get stressed with little things that don't stress me out, and how sometimes those same people would have a higher tendency to address the stress, and I would be like, oh, I can't handle it. So it's very interesting. Thank you for that. In that question, does stress lead to other diseases, or is stress the underlying reason for most of the diseases that we see, or the non-communicable diseases that is so spoken about in the media or in our circles nowadays?
Yes, you are absolutely right, Prameet. So, we in fact say that stress is the mother of all diseases. And mother of all diseases meaning the lifestyle diseases, which Prameet referred to as the non-communicable diseases. Non-communicable meaning that which does not spread when we are in the proximity of each other. So, non-communicable. COVID-19 is a communicable disease, because if you are in close proximity with each other, it's infectious, it spreads, the infection spreads. But non-communicable diseases are those group of diseases which slowly enter your system because of all the lifestyle, because you don't lead a very healthy lifestyle. For example, the biggest problem that we face in modern life is we all do desk jobs, which means that we are sitting for long periods of time. We lead sedentary lives. Our physical activity has reduced. And then what happens? Oh, I have to, finish this work. My boss has asked me to give me this paper immediately. So I'm going to skip lunch. And then I will just go and have some snack, some sandwich or something. And this we see every day in our lives. So no attention to diet, proper, regular, timely diet, no healthy diet, whatever you get you have. So diet plays a big role. Then no activity, just sitting, sedentary lifestyle. So all these aspects, factors in our life which have now come because of the modern day life that we live, that puts a lot of stress on our system. And for example, like we are made, human beings have been hunter-gatherers. They used to roam around earlier in the forest, but now we do desk jobs. There is reduced activity. So all the food that we consume, all the sugar that is secreted in our body, how will it get used up if we don't, we keep eating, but we don't use up that energy? Then it is going to accumulate. We are going to have increased blood sugar levels. That is also going to change into fat deposit. So obesity, diabetes, and then the stress that will put our entire body mind into a state of vigilance, chronic vigilance, which means that added tension, added blood pressure. So all these things are a part of our modern day lifestyle, which manifests because of stress. And stress results in all these group of diseases called non-communicable diseases. And in fact, we should take the right step at the right time and be alarmed that just the 4 group of diseases, which is heart diseases, and then we have respiratory diseases, then we have diabetes, and we have cancer. Just these 4 group of diseases account for 70% of global deaths, global premature deaths. So, and stress is the underlying factor for all these things. Somewhere it is because of some sort of stress, and of course genes play a role. Stress is just adding to the genetic vulnerability. So we need to pay attention to this and try and definitely modify our lifestyle, but also see the other aspects of what we can do to sort of counter these stressful situations and how we can modify our lifestyle.
Great.
Yes.
So does stress take time to reach a certain stage, or does it like happen in one day, or is it like a behavioral pattern, or is it an adopted part of our lifestyle? So could you guide us on, are there different stages to stress, and if so, what are the stages?
Yeah. So yes, so I did tell you that stress manifests as these chronic diseases, and now Parmeet has prompted me to tell you how really that stress translates into a chronic disease. So, we will go through the different stages of stress, and this is more of a yogic view to stress. So, stress does not translate into a chronic disease overnight. It goes through at least 4 stages. So, the first stage is the psychic stage. Psyche means, you can translate it loosely as the mind, which means that at the level of the mind something is happening. What is happening? Emotional disturbances are happening. Emotional disturbances in terms of irritation and tension, anxiety, all these emotional upheavals that you will go through. Basically imbalance, disturbance, you're not well, something is wrong. So, now at this stage of stress, if you pay attention and if you do something about it, do something to counter that emotional disturbance, do something to relax and take care of yourself. If you do this, then there is 100% reversal of any disorder which will come because of these emotional and psychological disturbances. But what do we generally do? We sort of neglect. We do not have this attitude of self-care. So, what do? We just, okay, we take it and then we try and just go about our lives, with so much of imbalance in our mind. So, then what happens? Then we enter the second stage of psychosomatic stage. These are a little technical terms, but it's not so difficult to understand them. Psychosomatic. Psycho meaning, of course, related to the mind. Somatic meaning related to the body. Soma is the body. So, psychosomatic meaning those things which were only at the level of the mind have now seeped into your body as well. And how? Prolonged and intense emotional disturbances reflect in certain changes in the body. So, what happens? Symptoms start to show at the level of the body and mind. Like, your heart will start beating very fast because you have to meet a deadline, right? So, there is palpitation. Your heart is, it's like it's not your normal heart rate. Constantly it is beating fast. It's not like, okay, you run for 5 minutes and come, your heartbeat is high and then it settles down. It's not like that. Constantly your heart is beating fast. Then you feel breathless. You feel you're gasping for breath. So, these symptoms, although if you look at the other stages that I'll be talking about, these are milder symptoms. But what is important to remember is that stress has entered the level of your body. So, here at least after noticing that you don't feel well, your body does not feel well, your mind does not feel well, if you notice this, if you become aware, if you do something about it to counter this stress that you're going through, then there is still hope. Like 30 to 70% likelihood of regaining your health. Why? Because it depends on how committed you are to take care of yourself and what steps you take to do that, or you just neglect, ignore and just go about your life. So, depending on your motivation, depending on your body mind constitution, there is a very strong chance that you can regain your health. But some people, they just, no matter how educated they are, they will, in this matter of their health, they will just still ignore everything, they will not take care of themselves. Then you enter the third stage of stress, which is the somatic stage. Soma, I told you, is the body, which means that from just the body mind level of mild symptoms, now it has entered your body deeply, which means what? That functional changes have started taking place in your body. So, the heart palpitations, your heart beating boom, 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 you know, you feel that. It is a very obvious signal, you feel that, but you have neglected that. So, if you neglect that, so prolonged heart palpitations, this will result in high blood pressure. Why? Because your heart is pumping constantly, it is not the usual heart rate of pumping blood, which means the pressure in the blood is going to increase, and it is going to manifest in high blood pressure. Breathlessness, it will lead to asthma, the initial stages of asthma. So, something which was so normal, your heart functioning, what does it mean? Your heart is beating normally. So, something which was so normal, your breath rate, normal breath rate, all that has functionally changed into higher heart rate, not being able to breathe properly, breathlessness. So, at this stage, disease has become chronic, and at this stage, even at this stage, I will say, if you take care of yourself, if you do something about it, there is at least a 20% chance of regaining your health. Now, some people, they just again neglect themselves, they do not take care of themselves, they just again, you know, they just go with the situation. Then you enter into the fourth stage of stress, which is the organic stage of stress. Organic meaning related to organs, which means that your organs and tissues have started seeing the effect of the stress, and they have started getting damaged. And here what happens is, from functional change there are structural changes in your body and in your organs. What does that mean? So, there is the heart, it is such a small organ, right? And we saw that we did not take care of our heart, our body in the somatic stage of stress. So, the heart is so small, it is pumping, there is high blood pressure, and that small heart is taking so much of pressure. What do you think will happen if this is chronic? Won't the heart enlarge? So, isn't there a structural change in the way your heart is and was? So, you have, just because of something that you did not take care of in the initial stages of stress, you have sort of damaged the organs and tissues in your body. Heart is one organ that I am talking about. There are so many other organs which get damaged. From functional change, it becomes a structural change, and then it is, so uncontrolled high blood pressure will result in enlargement of the heart, and it is an advanced stage of disease. It is almost irreversible, because you know, once that structural change is happening, after so many stages you have entered that fourth stage, it is not going to be easy, almost it is going to be impossible to reverse that stage of disease. So, it is almost irreversible. There is only 5% likelihood, that is a chance likelihood of you regaining your health, and the only thing that we can do at such a stage, if the person is try and prolong their life and let them have a peaceful death. So, this is how something which we use in our day-to-day life, a word stress, but it turns into a fatal factor. So, that is something which we should always be aware of, that be aware in the first stages, so that you do not enter the next stages, and you nip the problem in the bud itself. Yes. So, I hope that has been a good overview of how stress translates into chronic diseases.
Fantastic. Some very wise words. So, if you haven't woken up already in this year, I suggest it's a good time to wake up and take responsibility for your health. Are there good and bad stresses, or is all stress the same?
Yes. So, we have seen the darker aspect of stress.
Correct.
We will try and see the positive aspect of stress as well, because like you know, we are sitting here shooting, and there is some amount of stress also that we have now. So yes, there is good stress and there is bad stress, and good stress is called eustress and bad stress is called distress. Now, I'll put up a slide there which will help you explain this, which will help explain this concept. So, I call this diagram the bell curve of stress. And in order to help you understand this diagram, let me just explain what is it that we are looking at. We are definitely looking at stress levels, which is plotted on the x axis, that the bottom line, and then we are looking at performance, which is plotted as a y axis, the standing line. So, we are plotting stress levels versus performance, and we are trying to see how does stress affect performance. So, you will see that there are 4 blocks there of different colors. Let us start with the first green block. So, it is too little stress, and so you are basically inactive. You are not thinking too much about anything, but suddenly you get a message that you have a task to complete by the end of next month. So, you have like a good 1 month's time to complete it. So, you are a little laid back. So, stress has increased slightly, but still you are laid back. But then your performance is slightly increasing. Why? Because you are trying to do some spade work, you are trying to talk to your team members, you are telling them that, see, you know, we have this message, so we have to gear up, so who will do what, maybe some distribution of responsibilities you will do, but still you are not getting actively involved in the task, you are just doing some spade work. Then as the deadline slowly approaches closer and all your team members have gained momentum and you also gain momentum, you slowly enter that yellow block, and that yellow block is the interval of optimum stress, because stress has increased slightly and you are also trying to gear up towards the task that you have to meet, the deadline that you have to meet. So, that is when your performance is optimal, the yellow block. Now, if it so happens that, say, 2 team members in your team, they are supposed to handle very important tasks related to the deadline, they suddenly fall ill. Say for example, they catch the COVID infection. Then what happens? Then the deadline is approaching closer, so the stress level has increased, but your performance from that optimum level of stress, now it will slowly turn to fatigue. Why? Because the deadline is very near and those people who are supposed to do the most important task, they are not available. So, then you reach that tipping point of fatigue, from where you will enter the orange block of exhaustion, and as you know, just 1 or 2 days left for meeting the deadline, and you have still not figured out what would be the best way to manage the situation. You enter into the anxiety and panic attack sort of a situation, wherein there may be a breakdown and there is extreme stress, and you may be completely burnt out. So, it's now that we are aware of how stress affects us, we can be in the healthy blocks. If there isn't any stress in our life, then we can be in the green block, which is fine. If there is some situation, some demand that we have to meet, then we will stay in the yellow block. But we should be aware when we are trying to get into the orange and the red block, and again here awareness helps, because sometimes you can't help. For example, the situation that I talked about, your team member catching COVID infection, or suddenly there is acute stress in your family because somebody has become bedridden. Sometimes you cannot help it, but every time we do not need to put ourselves into this situation. When it is in our control, we can take charge of the situation. When sometimes the situation unexpectedly is out of our control, then we will deal with it. Our body has the capacity and intelligence, our mind also has the intelligence to deal with the situation. But constantly, if we are racing our system to meet demands day in and day out, then we are putting a lot of pressure and stress on our system. So, there is good stress which helps you to perform, but when that starts increasing, when our resources also become unavailable, then you enter into those exhaustive stages of stress, which will definitely impair performance, because after that tipping point of fatigue, your performance is going to drop markedly.
That's fantastic. So thank you so much for that lovely bell graph or bell curve.
Yes.
That's so enriching, and it's really interesting how by looking at data like this, you actually feel reassured that you can identify it. Could there be certain factors that we can use to identify when the stress factors are coming in? And secondly, are there any tools and strategies that we can use?
Yes. So, like we were discussing, right, that stress affects people differently, and so how can we identify, like every person is different, so how can we identify those factors which affect us and which stress us out, and what could be the tools? So, I'll take it one by one. So, identify factors of stress, it is not so difficult, because there are two things here. One is when you feel stressed, you feel that something is not your usual self. In fact, when that stress becomes too much for you, then you start looking sick. You know, your general facial expressions are that of exhaustion, and in fact you start getting the feedback also from people whom you meet on a day-to-day basis. What happened to you? Why do you look so dull? You look so tired, you look so weak. What happened to you? Is everything okay in your life? So when you start getting that sort of a feedback wherein, you know, your appearance is looking sick, then you need to take care. And this thing you can also cultivate as an awareness factor, because if you are aware about how your body feels normally, how your mind feels normally, then you know what is not normal. Then you know that there is something which is going wrong. You don't have to wait for people to give you that feedback, but that feedback will come. Even sometime, at some point in time, it will come. People whom you closely interact with, they will give you that feedback. But you can also be aware, and you can also identify what is that optimum stress interval for you, and how do you try to stay there and not get into the orange and red blocks. If you know that, you know, it's a very important deadline, then you create a backup, that if somebody is unavailable, somebody else can cover for that person, or you do something. So you try to stay in that optimum interval of stress. So that's one thing. So basically preparing backwards, like I would call it. And definitely there are tools and strategies to address them. So for example, you know, just the very simple process of relaxation. Even this much will help you counter stress. Just sit comfortably, if possible sit with your back a little erect, because posture creates a lot of difference, the way our body communicates to the brain. So try and sit a little comfortably with your back erect, and then relax your body. Try and just, you know, just not think about anything else, and then start focusing on your breath. Slowly, 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 just start noticing noticing your normal natural breath. And once you do this, then you also try to take slow, deep breaths. Just lengthen your breath a little bit. So even this much you do for 5 minutes, you will feel refreshed. If you do for a longer time, say for 10 minutes, 15 minutes. If you're feeling too stressed, too overwhelmed, too saturated, just do this much. Just sit relaxedly without anything going on in your body, mind especially, and not fidgeting with your body, and just focus on your breath, slow down, take slow deep breaths, and this will relax you. So, this is a very simple strategy which anybody and everybody can do. So, this is one mechanism that you create in your body and your mind to counter stress in intervals. Like you work, you rejuvenate yourself, you get that energy back, again relax for some time. Again you rejuvenate yourself, again work. Okay. So, if you do this, if you slow down a little bit, and if you have more of the relaxation that you need for your body and mind, then definitely stress is not going to affect you as badly as it would have otherwise affected you.
No, fantastic. As you were asking us to breathe, I actually shut my eyes and did about 2 minutes of breathing. And I don't know if you can see the difference on my face, but I can definitely feel it. So, in addition to that, does yoga practice, or can yoga practice help us in addressing these stress factors? And if so, can it help in chronic diseases?
Yeah. So, the answer to your second question first, yes, okay. Definitely. If stress translates into chronic disease at some point in time, and if yoga can help in stress, then it can definitely help in chronic disease as well. Now, saying this is very easy, but we also need to know how, or at least we need to know some of the mechanisms related to how does this happen. How is it that yoga is very powerful in not just contributing to reducing stress, but also trying to prevent or manage chronic disease. So, what I would say is there are a lot of mechanisms that we can talk about, but I will try to keep it simple for our viewers there. So, we have this mechanism inside our body which we call the fight or the flight mechanism, which means that if there is a threat in front of us, how do we deal with it? We try to fight it. If we cannot take care of that threat, then we will flee the situation. So, if a snake will come in front of you, you most probably will try to flee away. You are not going to try and fight it. But there are other circumstances in our life wherein we try to fight the situation. So, this is basically called the fight or the flight response. And when there is this sort of response in our body, then our body is geared up for activity, which means that in our central nervous system, the autonomic system which is responsible for all the involuntary actions, those hormones are getting secreted, which will help us to fight the situation or even flee the situation. Basically, all the blood is getting circulated to our hands and to our legs, to our extremities, so that we can do something about it, we can get into activity, and this in scientific terms we call the sympathetic dominance, sympathetic activity dominance. Now, totally opposite to this is another mechanism in our body, wherein the blood flow is more to those areas which help us to digest food. So, this is called the rest and digest mechanism, which means blood flow is more to the abdominal area, so that there is better digestion. So, it's this rest and digest means we are relaxed, there is no need for activity as such, there is no threat that we perceive that we have to deal with. So, this is the parasympathetic dominance, when we are relaxed and we are into the rest and digest mechanism. Now, what yoga does is, and I am talking about traditional yoga here, I am not talking about the power yoga type of yoga, I am talking about those practices which are more awareness based practices. So, at Kaivalaydhama we follow the traditional style of yoga, the Ashtanga yoga of Patanjali, and we follow the principles related to that. So, what is this? This is more awareness based practice. So, when we do asana, We are doing movements, but we are not doing gymnastics. We are doing movements in such a way that we are becoming aware of each and every part of the movement and how our body is in that movement. So that's the awareness that we are building up. Then we go on to our breath when we do pranayama. We first try and be aware of our breath and then try to voluntarily regulate it, and then we enter into the higher stages of yoga. So all this is the rest and digest mechanism as opposed to the fight and flight mechanism, the parasympathetic dominance over the sympathetic system that we have. So once we are doing yoga, the awareness based yoga that I am talking about, basically all the speed activity is replaced with more rhythmic activities, more awareness based activities, and awareness can only come when we slow down. So traditional yoga is all about slowing down and building more awareness, and asana is one way just to use the body as an instrument to cultivate this awareness and train our mind. It is yoga is not just asana. Asana is just one small part of yoga. There is so much more in yoga which can help build that awareness. But yoga is awareness. If I have to keep it very simple, we say yoking our body and mind. Basically, what does that mean? It is integration of all parts of our body. Which means what? It means that that integration is not going to come unless and until you are aware of your body and mind. So that is how, when we slow down with the help of yoga, when we build more of the parasympathetic dominance in our body, then we are countering stress. So that is why I said even simple practices like relaxation will help. Just lying down in shavasana will help you, if not anything. But we have to do this, we have to practice yoga. We can practice other activities also. If you like to take a stroll in nature, go for it. It may not be yoga, but it is yogic. You are connecting with nature, you are relaxing yourself. It is a recreational activity. When you do your hobbies also, you are doing the same thing. So yoga is one thing, being yogic is another thing. We have to have both, not just yoga on the mat but also off the mat. That is also important. Yes.
So that's some very profound knowledge over there. Thank you very much. And I would completely agree with yogic in yoga, because I have observed sometimes when I've gone for a nature walk and after coming back, and if I'm lying on the mat, the body starts to do its own poses, if I may say so. It's not as freakish as it sounds, so don't worry about that. But yes, absolutely correct that a harmony with nature is where it all is. In saying that, do we have any research material that we can share with our viewers in terms of how yoga practice can help with chronic diseases?
Yes, I can definitely provide a couple of studies there which I was involved in. First, we will look at a case study, and this is related to a lady who had come to Kaivalaydhama, and she was a cancer survivor. So she came here for a week, and so you'll see my heading there on the slide which says, can a week of yoga practice help a cancer survivor? 1 week is too short a time, but we wanted to do something for her. She was aged 35, let's call her DB, and she was diagnosed with breast cancer in December 2016. She finished her chemotherapy and radiation treatment in August 2017, and October 2017 she had come to Kaivalaydhama, hearing of some programs that we were conducting here specifically for cancer patients. So at that time the specific cancer program was not available, so she said that okay, now that I've come here, let me just see what yoga can offer me. So she came for the 1 week yoga relaxation program. And what we did was we, in addition to the standard yogic practices, we also offered her some additional sessions. So, you will see the next slide coming up there, which talks about all the structure of the detailed program that we offered her at Kaivalaydhama. So, in addition to 1 hour of yoga daily in the morning and evening for that 1 week, we offered her Yoga Nidra sessions, 4 of them, 2 meditation sessions, 2 Trataka sessions, and these additional sessions were spread over 4 days. And this was of course offered by a senior yoga therapist who had already worked with cancer patients earlier. So, we wanted to also monitor the efficacy of these practices on her. So, what we did was, when we were offering these additional sessions of yoga to her, we did some psychological tests before the additional sessions and after the sessions. And we also requested her to keep a personal diary every day for the 4 days. And we gave her 2 questions which were related to her feelings, her experiences with the practices, and if she noticed any significant changes in them. So, in the next slide you will see that there is some data out there which I have put out, and that is related to the profile of her mood states. So, what you will see there is that in her various moods of tension, anger, depression, confusion, you will see that there is a marked difference. And the total score, which shows there as the TMD score, which is the total mood disturbance, you will see that there is a marked drop in her mood disturbance. Tension has increased slightly, confusion has increased slightly, but her depression has come down, anger has come down, her vigor increased. So, all these changes you will see. Fatigue has came down almost to nil. So, tension and confusion, why did they increase? We can say that probably she was a little worried about, now she is in good hands, but what will happen once she goes back to her life, and will she be able to sustain the effect of these practices? Probably that, or it may be she was becoming more aware of herself when she was after the yogic practices, when she was responding to the questionnaire. It could be anything, but what is important is her total mood disturbance did come down. So, the total mood disturbance is a global score combining all the other 6 scores of tension, anger, confusion, depression, vigor, etc. So, what we see there is that there was a drop in the total mood disturbance score, which is the global score, the combined score of all these other moods that have been listed there, of tension, confusion, anger, fatigue, vigor, depression. All these mood states were combined into this total mood disturbance score, and when we take it globally, we see that there is a marked difference, the marked drop in the mood disturbance that she faced. Now, we will look at some qualitative, actually there is one more slide related to quantitative aspects of the psychological tests, which we can show as graphs as well. So, we did 4 more tests with her, and here we will see that her anxiety, this is clinical anxiety, her anxiety dropped a little bit, her depression also dropped a little bit, just within a span of 4 days we are talking about. And then we were talking about stress and perceived, the perception related to stress and the coping related to stress, how that fits into an equation, right. So, here you will see that her perceived stress levels have also dropped and her coping capacity has increased, which means that sometimes it is possible that the disease relapses sometimes, and in our day to day lives also we see that we cannot avoid stress. What is important is how do we perceive it, is our coping capacity increasing, related to that stress. So, these were some results there, and now we look at some qualitative data as well. And in the next slide, what I am going to show you is a couple of sentences from her diary, from the personal diary that she maintained. So, I am going to read a couple of sentences from each of the 4 days of the diary that she maintained, and you can see the gradual change in her thinking, in how she reappraised the situation. And this in psychology is a very big word, reappraisal of the situation. And that is all again related to individual perception. How do we perceive? So, the first day she writes, there is so much of pain and hurt within me which I need to let go of. I realized that I had to first forgive myself before bringing upon the forgiveness of others. This is the first day. First day meaning the first day of the additional practices. So, this was already the second or the third day of the yogic practices, the standard yogic practices after coming to Kaivalaydhama, and this was the first day of the additional practices that we were giving her. Second day she says, I learned to deal with the belief or judgment that I had formed about my own self. I have felt more composed because of the meditation session. So, this is the second day, how her thoughts started changing on the second day. And then the third day, she says, I have now realized that we have so much more to experience, feel and admire within our own mind, that our feelings of hurt, pain, anger, anxiety need have no place in our mind. So, this is a very gradual evolution of her thinking process. And then fourth day she says the week long practice, that means it was almost toward the end of the whole week on the fourth day. So, the week long practice has left me almost completely cleansed in my mind, with no negativity left at all. I couldn't bring forth any memory associated with pain, hurt, anger, etc. All that I felt was peace and solace. So, you will see that how even a week of yoga practice, of course, it was intensive yoga practice, it mattered to a person who was suffering from cancer. And it is actually the qualitative data which gives us more insight into what changed significantly for her, what shifted for her, and that shift is very important, that psychological shift is very important for your own empowerment. Now, the next study that I will display for you over here is a proper research study. The earlier one of DB was a case study. Here it is a proper research study of several such cases that we collected data from at Kaivalaydhama, and I was involved in the study, and the other investigator, the principal investigator was Dr. Usha Nair. She is no longer with us, but we definitely have the results of this study with us, and this study was done when Ms. Lee Majewski was doing the cancer and chronic cures programs for us, and this data has been collected from those patients. They were coming here for a 3 weeks yoga retreat, and the one program was limited to just 8 or 10 people. And the data that I am going to show you now is related to 4 such programs, 2 of cancer and 2 of other chronic diseases. So, the way we planned this research was to see the psychological impact of yoga on cancer and other chronic diseases, because it is important that once you are detected with cancer or any other chronic disease, the debilitating feeling that you feel in your mind, are you able to overcome that? Because other standard treatments are available. you go through chemotherapy, you go through radiation, it puts a lot of stress on your system. Why? Because you feel out of control. Somebody else is taking care of you, and the chemotherapy, it's creating so much of nausea in you, your digestion is very poor, so you don't know what is happening to you. So psychologically you become very weak, and then there is always this fear factor that what if that cancer comes back, or what if the amount of control that I now have over my life, that goes away suddenly. So that is why we wanted to monitor the psychological impact of the yogic practices, which were done for 3 weeks. So we made it into like a long term follow up study, and we had data from 31 patients, and out of that 15 were cancer survivors and 16 had other chronic diseases, which included diabetes, hypertension, certain skin problems like psoriasis and various other chronic diseases. So collection of data was when they came into Kaivalaydhama for the yoga retreat. First day we took psychological data through the tests that we administered, and then just before they left Kaivalaydhama after 3 weeks, on day 20 we took the second set of data, and this was all here physically. We took data from them. Now they had to go back, so we had to keep the online follow up. So we collected all the data from them at 3 months, 6 months and 12 months online. So this was like a long term study, and the yoga retreat per se, it had an intervention of 135 hours in 3 weeks, which means it was 45 hours of intensive every week. And the therapeutic intervention was definitely focused on yoga practices, but it had also some other elements, and you will see there those other elements. So Shuddhi Kriya was definitely a yogic practice, asana, pranayam. Then we also included naturopathy treatments to give them more relaxation, help them connect to more natural elements. Then there was relaxation and awareness activities, lecture, discussion, group sharing. There is a lot of power in the group. Once they are in a group of people who are going through the same life experiences, they can derive a lot of inspiration and energy. Then yoga nidra was there, and finally after dinner their day would end in chanting and silent meditation. So that is why it was a 45 hours intensive session every week. So now let's look at the data there. So I have 4 graphs for you in this slide, and these 4 graphs are related to all the negative elements, negative psychological elements, and we want to see if those negative psychological elements reduced over a period of 1 year. So how do you interpret this graph? Let's look at the first bit of that graph there. This is about depression, HADS depression. So you will see that when they came in on the first day at Kaivalaydhama, day 1 of Kaivalaydhama is the first point there. That's so high, and day 20 of the data collection point was when they left Kaivalaydhama. You will see a marked drop there, and it's a very significant drop even statistically. And then you will see at 3 months, 6 months and 12 months there have been certain fluctuations, but even if you take the last time point of 12 months, you will see that it is way lower than the first time point, which was very high for the depression. So what it means is that the gain that was there in terms of lowering their depression levels on day 20, that is when they were just about to leave Kaivalaydhama after the 3 weeks of the yoga focused interventions, that sustained even after 1 year. And you will see this with every other graph there. Even anxiety, you will see the same pattern. When they came in, it was so high, the anxiety, it dropped markedly, then there were certain fluctuations, and then at 12 months you will see that anxiety has remained lower only. It is not as high as it was when they had come. And this is the data of 31 patients, which is although it is a small sample, but still taking a long term follow up over a 1 year period, this data is very powerful to indicate that how yoga practices, when learned, sustain its effect over a longer period of time. And you will see this with the other factors also there, with perceived stress and with mood disturbance as well. The same pattern, very high when they came, dropped markedly when they left, and then some fluctuation, and then again it is compared to the first time point of when they came here, it is still low at 12 months. Now, I will put up the next slide there, which again shows 4 graphs, and this is about the positive indicators of overall quality of life and psychological well-being. So, you will see that in these 4 graphs, the pattern is exactly opposite of the earlier 4 graphs that I showed about the negative aspects of psychological parameters. So, here you will see there is coping, there is psychological flourishing, there is psychological quality of life, social relationships. When they came, it was very low, it rose markedly just before they left, and some fluctuations, and it is still high. So, all the positive parameters improved, and that gain in these parameters which yoga sort of helped them with, that sustained even after 1 year, which means that whatever practices they may be doing, they may not be following it thoroughly like we did here when they were here for 3 weeks, but even with the little practices that they did and the perception and the reappraisal of their situation, that sustained. So, there was actually psychological empowerment that these people had, and all these are statistical differences, statistically significant differences. The difference between the first time point when they came here and the 12-month time point, huge statistically significant difference. So, I think this is some data that of the studies that we have done at Kaivalaydhama that is very eye-opening for all of us also, and for anybody who looks at this data. It just shows the power of yoga, not just on the level of the body, but especially on the level of the mind, because only if you are well as a whole person do you feel good within your mind as well. So, I think that should give our viewers some motivation to practice yoga, and you can definitely go online on kaivalaydhama.com and check our online resources there, all the content that we have put in there. You are most welcome to come to Kaivalaydhama as well, and you do not have to enter the disease stage to practice yoga. You can just prevent the disease stage by living a yogic lifestyle and by incorporating certain yogic practices in your life.
So, would that be a take back for them, that they can take back with them after all this fantastic data and research material? What are the take backs for them? What are the simple things that they can do?
Yes, yes. So, like I said, it's very important for you to build awareness within you. This is one thing, but that will come slowly. It will not come so easily. So, what I would suggest is a few simple things. If you do this, probably you will be able to deal with stress better, and these are all yogic things, not necessarily yoga practices, but these are yogic practices because they come from the same principle of a yogic life. So, first thing, slow yourself down, because stress and speed, they go together, and slowing yourself down is like the opposite of creating a stressful situation. Just slow yourself down, relax as much as possible. What I had told you, the simple tools that I was telling you, that just sit comfortably, relax yourself. You cannot underestimate the importance of relaxation in your life. If possible, lie down in a very comfortable posture and just start focusing on your breath. That will give you more relaxation. But say in our day-to-day lives, we don't have the space and the time to lie down and relax. So we can just sit on our chair, just relax, focus on our breath. And one thing that you can do is, you will notice how easily you feel relaxed with this particular practice that I am going to suggest to you. In fact, I think I can demonstrate it for you as well, because it's a very simple practice. So let's just sit as comfortably as possible, but with our back comfortably erect, our hands and feet well rested, especially our feet. Make sure that you have rested your feet very comfortably on the floor. Your hands, initially they can be well rested in whatever way you can, and then have a comfortably erect back. And now you put your both your hands, or at least one of your hands, on your abdomen there, and then now slowly close your eyes. You can put your other hand on your chest as well if you like. So now with eyes closed, just start focusing on your breath. Try to feel all the sensations related to your breath. Just try and observe your normal, natural breath as closely as possible. Try to sense the movements related to your breath in your chest, in your abdomen. Also feeling the sensations inside your nostrils. How does your in-breath feel? Does it feel cool? Does it feel warm? How does your out-breath feel? Is it cool? Is it warm? Just notice. Try to stay with your breath as much as possible. And once you have developed this focus on your natural breath, now try and take longer and deeper breaths. Slowly try to lengthen your breath. There is no need to count at this point in time. Just whatever happens very naturally and spontaneously, just let it happen. Your hands on your abdomen and on your chest will help you feel the activities and the movements related to your breath more closely, and try to keep awareness on your breath. Slow yourself down, slow your breath, make it longer and deeper. Now what we will do is, we will try to deepen our breath to the count of 5 inhalations and 5 exhalations. Try to do it with me. If 5 is not possible, do 4 inhalations and 4 exhalations. So count in your mind. The pace will be 1, 2, 3, 4, 5. Again, exhale. 1, 2, 3, 4, 5. Your breath should flow. There shouldn't be any jerks, but maintain this pace like the second hand of the clock. 5 seconds of inhalation and 5 seconds of exhalation. Continue to do this. If possible, you can do it for 5 minutes at least. Keep the counting on your mind. 5 seconds of inhalation and 5 counts of exhalation. Now slowly we will try to come back. You may release your hands. You may take normal breaths. And whenever you feel ready, allow your eyes to open gently. So this is a very simple practice that you can follow for 5 minutes. What you have basically done is you have lengthened your breath to a 10-second breath, which means that in 60 seconds you will only have 6 breaths. Normally we breathe at the rate of say 10 to 12 to even 15 breaths per minute, that is in 16 seconds. Our breath is so shallow. By prolonging your breath in such a manner, you have given your body and mind that opportunity to rejuvenate, because breath is the bridge between your body and the mind. Anything that you do to your breath will affect your body and your mind at the same time. So this is like, with just one arrow you are getting 2 things done. So just work with your breath. Even as simple a practice as a 10-second breath, trying to enable that will give you relaxation. I personally am feeling so relaxed and refreshed just with these 3-4 minutes of this practice. So I'm sure if you do it for a longer time, it will give you even more benefit. And this is one way for you to cultivate that yogic eligibility, I would say, because once you start doing yoga, you will engage in greater regulation of your breath through the pranayam practice. And you're most welcome to come here and learn all the pranayam practices. Also go online and do it, and I'm sure you will have a lot of resources online if you're not able to come here because of COVID. But slowly, even this pandemic will pass away, and you will be most welcome to come here. Even now you are most welcome to come here, but just be with yoga, because yoga will give you that power, that strength to build your immunity in pandemic times and just to have a very healthy, happy, peaceful life.
Thank you. Well, we all live to be healthy and happy, so why not adopt yoga into our daily lives? So, Doctor, thank you so much for your lovely wisdom and lovely practices, and I hope all of you have had a great takeaway. By doing these breathing exercises, this could be your starting point. It was a pleasure to have you all on board at Sundays with Kaivalaydhama. You can always go on to www.kaidham.com. You can book yourself a stay over here, or you can go through the digital resources that we have. Namaste and thank you.
Namaste. Thank you, everybody.